And you also do the dialysis work?
I do.
Is that full-time?
What do you mean by full-time?
Well, it typically means 40 hours a week, something like that.
I wish I worked 40 hours a week, and so does my family.
So the question's still out there. Do you work?
I work a great deal of hours every week.
Okay. How many hours do you work in dialysis?
And, you know, I'm not being glib, but the real answer is I see every patient every week, and I work as long as I need to. It's variable. Sometimes it's many, many hours. Sometimes it's less hours.
Approximately how many hours a week do you work in dialysis?
I don't know. I couldn't quantify that, sir. I don't keep track of that.
You can't give me a range?
I really can't. I honestly, I don't count them. I don't track them.
Is there a reason why it's so difficult for you to answer my questions and it was so easy for you to answer Mr. Chernoff's?
Objection argumentative. Sustained. You need not respond. Your next question, Mr. Walgren?
You can't answer how many hours you work in dialysis. Is that correct?
What you're asking me is extremely nonspecific, and I'm telling you honestly, I don't measure.
How many hours did you work in dialysis last week?
I don't know.
I was specific.
I was at the dialysis unit Monday morning and afternoon, Tuesday for a few hours, Friday for a few hours. That's my typical week. Sometimes I go on Thursdays, sometimes I don't. Sometimes I go on Tuesdays, sometimes I don't.
Would you agree that in the field of addiction medicine, that it needs to be confronted as a real clinical disease with very real clinical roots?
It's absolutely a brain disease, and it needs to be treated as such.
And that's one of the reasons why, to competently handle it, you should have experience to handle it, correct?
I believe you're exactly correct. Experience is really important.
And from the Cliffside Malibu website, where your picture is posted, it states, as is true of any disease, addiction can only be overcome with intensive medical specialized care.
Which is provided at Cliffside Malibu, not by Dr. Waldman all the time.
But you agree with that assessment?
I think it's a great assessment.
And you, of course, in your experience, have had patients come to you that had previously received subpar or incompetent addiction care and then came to you and you were able to help them, correct?
Your words, sir, not mine.
I'm sorry, are you going to?
I have no answer. I think I never made such statement.
I didn't ask you if you made that statement. I'm asking you a question.
No, you're actually putting the words in my mouth. Would you
Your Honor, would the court instruct the witness to answer the question?
Thank you. Cross-examination is, in essence, putting words in your mouth which you can either accept or reject.
I reject.
Okay.
So you have never had a patient come to you that you determined had received incompetent care and you were subsequently able to help them. You've never had that happen?
Sir, I never embellish what I do by denigrating what one of my colleagues does. Addiction treatment, casting dispersion at prior treatment, it's not necessary. When somebody comes to me for treatment, many times they've had prior treatment. Their success or failure of treatment is not a function of who treated them. It's a serious illness. Failure rate is twice the success rate everywhere.
So now, it's not a function of who treated them. That plays no role?
What I said to you in answer to your question again, sir, is that when I accept somebody in treatment, I don't speak negatively about their prior treatment.
I didn't ask you to.
Yes, you did. Or the treatment providers.
Okay. Mr. Waldman, have you ever had Dr. Waldman, have you ever had someone come to you and you've had an opportunity to review their prior care? Have you ever had that happen?
What do you mean by review their prior care?
However you want to interpret it.
You're asking the question, sir. If you ask me a specific
Your Honor, will the
question.
court instruct the witness to answer the very simple question?
Are you able to, or do you want it re-asked?
I would like it re-asked, please.
Mr. Walgren?
Have you ever, by any means, whatever you want to put into your answer, have you ever had a patient come to you where you evaluated, by whatever means you want to say, Dr. Waldman, where you've evaluated their prior care as it relates to addiction medicine?
Yes.
Okay. And have you ever had a situation where you did such an evaluation and determined that they did not receive proper care as it relates to addiction medicine?
Yes.
There. Thank you. And when you've had those situations where you determined they had not received proper care as it relates to addiction medicine, have you, as a specialist, been able to help them?
Sometimes I'm sure I have.
Thank you.